Hi. Okay, so really quick before we get into this video, I know I did not post last week, and that is because I've decided to post every other week instead of posting every week. So yeah, I'm gonna post every 2 weeks now, just because I've been very busy and it just works best with my schedule. Um, and another thing I just wanted to say, if this video is very jumpy and has a lot of cuts, I'm sorry. I had to stop a lot during the video, so I tried to make it as best as I could, but there are a lot of jump and cuts within the video. So, and also I said side effects of sickle cell a lot in this video. I actually meant to say complications of sickle cell. So not side effects, complications. Hey, it's Alo again. Nice to see you. Welcome to my second video, and I just want to say thank you so much for the positive reactions to my first one and all of the support that I've been getting from people that I've known for less than a month and people that I've known for years. It's really just been so great, all the support I'm getting and all the people that have shared and subscribed. Thank you so much. But so I've gotten a lot of messages since my first post, and a lot of them have been questions just about, sickle cell, what is it, how does it affect you, what have you been through. For this video this week, I would just talk about how I personally am affected by sickle cell, and just go in more in depth about how just the disease for me. So this video is really more about me. Sickle cell affects everybody differently, so what happens to me might not happen to another person with it. They might not have any of the side effects that I have. So just so you know. So but yeah, I'm just gonna go into detail about how it affects me more. I have type SS sickle cell, and that is the most severe. Some people who have SS, it is very severe. They're always in the hospital, always getting blood transfusions, always having side effects to sickle cell. I do go in the hospital sometimes. This past year in April was a very rough time, and that's a whole nother video. So just for me personally, I mainly get sickle cell pain attacks. And so, as I said in the last video, the pain attack is when your red blood cells sickle somewhere in your body. So for me, mainly, they sickle in my joints. So it would be my elbows, my knees, those are really big ones. Also in my back, my lower back, but it can also be my upper back as well. Sorry, it just started raining, so if you hear the rain in the background, I'm sorry. So luckily, I have not had a sickle cell attack in college, but I'll just tell you what I did when I was at home. So it would start off, usually it starts off low and mellow, I guess you can say, and it would be in my, maybe my elbows or my knees, and I would just be feeling pain there. And so then I would usually talk to my mom. I'd call my mom if she wasn't there, and I'd say, "Hi mom, I'm having, a little bit of pain," and then she would say, "Okay, we'll start taking your medicine." So the method that usually I go about it is, if it's really bad when it starts off, then I'll just take I'll just take all my meds, so it can we can just get it early and nip it early. But if it starts off lower and mellow like it usually does, then we'll usually just start off with some Advil. So I'll usually just take Advil, get a heating pad, and so this is my heating pad. I have two, and it's really nice because it's electric and it's really soft, so it feels kind of like a blanket, which is very nice when you're in pain. So I'll usually just wrap it around. If it's on my back, I'll just lie on it. If it's on my knees, I'll try to put the heating pad over my knees. If it's mellow enough, then we will just wait it out. Hopefully the Advil works, and just have the heating pad. So if the pain doesn't go away with just Motrin and resting and heating pads, then we will go on to the next medication, which is Norco. And I'll take one of that and just wait it out again. It's really just a waiting game. And finally, if Norco doesn't work, usually this is hours now, and so I feel like the Norco isn't working, I'm still in pain. Maybe it's enough time to take Advil again, or I'll take like a stronger Motrin to see if that will work. But if nothing is working, then we go on to morphine. And I do not like taking morphine. Usually at this point, if the pain isn't gone, then I am in my bed. I'll probably be crying. I'll probably not, like, there's just no comfortable position when like you're always in pain. I'm just not, obviously it's not a good time. I'm very irritable. After all of this, if I'm still having pain, I'm still feeling bad, and I've taken like all my medicines, this is when we would go to the hospital. My mother is a physician, and she actually specializes in sickle cell, so she knows a lot about it. So I probably don't go to the hospital as much as most sickle cell patients do, just because of my mother, and she knows how to care for me at home. Obviously, like, if it gets too bad, we're not gonna like keep me at home, so then we'll go to the hospital. I have a hematology and oncology clinic, so I wouldn't just go into the regular admitted hospital patient room. I would go to like a special floor for hematology and oncology patients, and hematology is blood disorders, oncology is like cancer. And in the hospital, you get an IV, so get poked here, and then you just basically are on non-stop meds and fluids until you feel better. Being in the hospital sucks, because at least when you're at home, you have the comfort of your own home. Sometimes they'll ask you to do physical therapy to help you feel better. Sometimes you'll just be in bed for days. Usually at the point when I'm at the hospital, a thing they always do with sickle cell patients is they say, how bad is the pain, from 1 being, it's fine, I can go home, to 10 being, this is the worst pain I've ever experienced. So usually when I go to the hospital, obviously I have a very high pain tolerance. So I usually say 6, 7. Usually I spend about 1 to 3 days in the hospital. Really depends on how fast the pain goes away, and them knowing that my mom is a doctor, they'll let me go early, because like at a certain point, like, I'm doing good as long as I keep up with my medicines. At that point, when like I can go home from the hospital, we will still have pain, but it will definitely not be as bad, and it will be okay as long as I have medications. When you're on the medications, you really don't, like, I can't really feel the pain as bad. How the pain feels, because I actually get that question a lot. For me, and as I said, every sickle cell patient, their pain feels different from mine, so don't think this is how everyone feels. But for me, it's a very powerful throbbing pain, I guess you could say. And it's like a mixture between like throbbing and aching. They always ask, does it feel like someone is stabbing a knife in you, or does it feel like you are on fire? Those are the two questions. So just imagine one of those two. So for me, it's closer probably to a stabbing pain, because of the throbbing, and just like it's very, very, very achy, and like sometimes if I can't move, because it would literally just make it worse. Yeah, that's usually what pain feels like for me. And as I said, I get it in my back, legs, arms. Some people, they get it, like, you can really get it anywhere. Another question I kind of wanted to answer is, like, because there are other things that can happen with sickle cell. Something that I've gotten a few times in my life, called acute chest. And I don't know if I'll make like another video about it, but it's basically when like you start sickling in your chest. It's usually what causes mortality in sickle cell, because like, it's a respiratory disease. Respiratory diseases are never good. Basically what happens, it becomes very, very hard to breathe. A lot of people are put on oxygen when they have acute chest. Your oxygen levels are very, very low usually when you have it. It can almost be like painful to breathe, since you're sickling in your chest. So it usually only affects people with sickle cell. It usually happens in children. I've had it, I think, 3 times. And the other main side effect or thing I've gotten with sickle cell is a bone infarct. So it's when your bone dies because it wasn't getting enough oxygen. First time when I was younger, I think around like 7 or 8 again, and it was in my knee. It's just like it was sickling for so long that the oxygen just couldn't get to the bone, so the part of the bone kind of just dissolves away. So yeah, those are just two um, side effects that come with sickle cell. There are many more. But yeah, that's just like what happens. And another thing, as a kid, you are as a kid with sickle cell, and just with sickle cell in general, you are more likely to get a stroke, because if you were to sickle in your brain, something you do as a kid with sickle cell is you get ultrasounds of your head every year, just to make sure that there's nothing wrong with that. And another thing is sickle cell can affect your eyes. They can really deteriorate the quality of your eyes. Having sickle cell, your immune system is more compromised, so you're just like more likely to get sick, like with strep throat or fevers or flu. It's very important that sickle cell patients get the flu shot every year. I think that's about it for this video. I also wanted to say, in my last video, I said that purple was the official color for sickle cell and the sickle cell ribbon. It is actually red, so I just wanted to clear that up. And once again, just thank you so much for watching, and thank you so much for spreading the word. I will see you next week, and I guess as of right now I'm posting every Wednesday, so I guess I will see you next Wednesday. I don't know if that will change or not. Just thank you so much for watching. I'm not sure what next week's video will be about, but I'm sure that we will figure it out. See you later. Bye.